Hello, I'm Dr. David Thomas. I'm going to talk to you today about steps to overcome depression. I'm a practicing psychotherapist in Tampa, Florida. Some of the materials you might need would be a quiet place, a piece of paper and a pencil, or a journal in order to reflect and to be able to record your thoughts. When we're talking about depression, like the other three blocks to happiness, which are anxiety, anger, and guilt, are nothing more than reflections of thought. And we call that cognitive depression. Now, along with cognitive depression, there's also what we call biological or endogenous depression, which is really a genetic predisposition towards being depressed. So when we're looking at steps to overcome depression, we're looking at primarily changing thinking. Now, the thoughts associated with depression tend to be H1 plus H2, which is hopelessness plus helplessness. Now, hopelessness is this idea that somehow things are just not going to get better, and helplessness is there's not anything you can do about that. So when we're looking at changing thoughts, we're going to begin to look at what are the thoughts that we have about certain life events. Now, the thinking that we're primarily concerned about is maximizing rational thinking and minimizing irrational thinking. The primary way to do that is first to isolate what is it you're depressed about, then ask yourself, what are you thinking about that event, and then determine whether those thoughts are rational or irrational. There's different ways you can determine whether it's rational or irrational, but the primary way is that rational thinking, if you can remember the acronym ELF, E-L-F, E stands for empirical data, is the thought you're having fact or fiction. L, logical, does it make sense? And F, functional, does it help you achieve your short or long-term goals? Does it help you stay out of conflict with others? Does it help you to preserve your life and limb? So if it passes those three criteria, then it's a rational thought and it's probably helping you. So continue to search for the ideas that are driving that emotion. Again, I'm Dr. David Thomas, talking to you about how to overcome depression.